going to actually highlight is, actually help persons to understand what do we at Batson and Associates actually do to address the situation of arthritis. So what really is arthritis? Is it linked to our diet? Can certain aspects of our diet and lifestyle actually contribute to making the situation either better or worse? So those are some of the questions that we're going to entertain. And of course, you have the option of WhatsApping the studio to ask any particular questions. Pleasant good morning to our Facebook listeners, because we are live on Facebook as well. So when you talk about arthritis, fundamentally, arthritis is a situation of high inflammatory response or high inflammation. Now, you find with high inflammatory response, you significantly get a lot of pain, you get a lot of swelling, and the areas tend to be very heated. So rheumatoid arthritis fundamentally is actually parasites in your bones. And, if someone has never heard about that before, that is exactly what rheumatoid arthritis is. Hence, the high amount of inflammatory response, because you have pathogens, either bacteria, virus, fungus, that actually has left the small intestines, gotten into the bloodstream, and then from the bloodstream, it gets into the bones. So in a situation like that, you have high levels of inflammatory response, and you have high acidity, you're going to have a lot of pain, you're going to have a lot of swelling. But in that particular situation, how do you really address that? Is it that you're going to actually deal with the root cause of the problem, or you're going to deal with the mosquitoes? As I was saying, I gave an analogy. I think it was Sunday, I was doing a program, not this Sunday, last Sunday, where I said, imagine you have stagnant water in your yard. And because of that stagnant water, you now breeding what? Mosquitoes, right? So if you decide to spray some sort of pesticide or something on Monday, Tuesday, or Wednesday, Thursday, you're going to be able to control the mosquitoes. But if you stop doing that for a week, what happens? The mosquitoes start back coming. So your symptomology is like the mosquitoes. So the symptoms that you have, the arthritis, the diabetes, the cataract, the macular degeneration, those are fundamentally the mosquitoes. In order to get overall results, you need to deal with what? You need to deal with the stagnant water. So exactly as it relates to that is the same that would apply to the situation of arthritis. Because if arthritis is parasite in your bones, it means that we need to get rid of the parasites in order to get rid of the arthritis. Simple common sense. And that is fundamentally what integrative, natural and integrative medicine really is. It is medicine where your objective is actually to deal with the root cause of the problem and not deal with the mosquitoes, not deal with the symptomology, but deal with the stagnant water. And that's fundamentally what we do at Batson and Associates. So you could feel free to give us a call. We do have specific testing services available. We do, as an institution, carry out what is known as live nutritional blood cell analysis. A lot of persons might say, well, A person does blood analysis, B person does blood analysis, C, and then you want to give me the whole alphabet. So, of course, the question arises, what is different from Batson and Associates? What do we offer different to someone else who would be doing blood analysis? And to answer that question, it fundamentally has to do with our protocol, the corrective protocol. Because you see, the thing is, as a lot of times your diagnosis is irrelevant. Your diagnosis, like the mosquitoes are not important to me. I know you have mosquitoes. The thing is, why are the mosquitoes there? And we know why, as I said, because of the stagnant water. So obviously, in addressing those situations, that is the difference with Batson and Associates as it relates to the protocol that is going to be set up either by myself, Mr. Green, and the other consultants that we have at Batson and Associates that are trained specifically to identify those key components of the root cause, the stagnant water again, and actually address it so that you could now have relief and long-term relief as a result of that. Okay, Karen, you could just speak a little louder for me. I'm hardly hearing you. Right. Mm-hmm. What was that? What are my thoughts on pain relief medication? Or creams and sprays? I mean, pain relief medication, as it relates to the sprays and those type of things, those primarily would have some magnesium in it. So you would have some natural things that is really going to help in the pain situation. So those technically not that bad. What you need to do is look at the ingredient profile and make sure it is non-steroid, because steroid can be absorbed dermally through the skin. And you know, steroids have a whole host of things that they do, corticosteroids that is, which are normally used in the treatment of arthritis. As it relates to the internal ones, those are the ones that I have the problem with, because when you abuse painkillers, which a lot of people like to do, you end up in a situation where you cause serious damage to yourself, and you, as it relates to damage to your kidneys, your liver, those major organs, even your gastrointestinal system, even your eyesight has been shown to be seriously affected by those painkillers and whatnot. So it's a matter of really, as I said, looking at the ingredient profile and really then addressing the issues from the root cause of the problem. So things, a simple thing as hydration, for example, if you're not properly hydrated, that is going to exacerbate the arthritis. It's actually going to make the arthritis worse. It's going to create an environment to make the stagnant water stay longer, basically. If it is you use a lot of inflammatory food, so you use a lot of milk, cheese, butter, a lot of fried foods, a lot of sugar, you're now feeding that inflammation and encouraging that environment that is now conducive to sickness. So in that circumstance, you can't get better. Because the thing is with medication, medication doesn't do any of those things that I spoke about there. No, medication does not reduce inflammation. I mean, yes, it does to an extent, but it more suppresses inflammation as opposed to reducing the inflammation. Two completely different words, different meanings, different connotations attached there. So one has to understand significantly that you need to address this thing from the root cause. Is it going to take you some work? Yes. Is it going to take you maybe some money? Yes, because it's a matter of you now eating properly, which is going to dictate some level of change, some purchase of supplements, vitamins, minerals, enzymes, phytonutrients, and whatever you may need. And as a result of that, you find that you would be able to get results from there. And that is what we do at Batson Associates. There's a product that we carry, for example, called Inflammation Formula. And that Inflammation Formula, liquid, very easy to use, so it's not tablets that you have to swallow, because I know some persons, you know, pills tend to throw you off a bit. So this is a liquid product, and you just basically take anywhere between 1 to 2 tablespoons in the morning in about 8 to 12 ounces of water, and then you do the same thing in the night. Empty stomach, and an empty stomach is either 30 minutes before or maybe about 2.5, 3 hours after a meal. Okay? Gouty arthritis, good. The thing is with rheumatoid arthritis, as I said, is primarily parasite in your bones. Gouty arthritis is gout arthritis, or inflammatory response, pain, swelling caused as a result of gout. What is gout? Gout is excess uric acid that actually settle in the joints. So as a result of that, you have an arthritic situation. So that is something. It is so the inflammatory response or high inflammation are what those two things have in common. But fundamentally, one is caused by parasite in your bones, which is rheumatoid arthritis, and gouty arthritis is caused by excess uric acid in the body, fundamentally. But both would give you the same result. So that's why I said again, a lot of the times your diagnosis is not necessarily important, because in both instances, we have to deal with the root cause of the problem. We have to hydrate the body, we have to increase oxygen, we have to alkaline certain systems, we have to increase oxygen and circulation in the body now to actually bring about some correction in these situations. Okay? Yes, those telephone numbers, again, you can give us a call on 222-8261. That's 222-8261, as well as 314-9975. That is 314-9975. And our locations, we are located on the first floor of Money Talks building. That is Money Talks building in Montrose, Chabonas. We're also on the corner of Ramsey Trace and the SS Erie Main Road in Davie, as well as Red Edge Mall, Western Main Road, St. James. And Tobago is the Triangle Building in Scarborough, Tobago. You're listening to Dr. Batson, the Senior Medical Consultant at Batson and Associates, your wellness solution. Okay, so let me see if I read your lips properly there. Is there a particular diet for persons who have been diagnosed with rheumatoid arthritis? That was the question. Okay, good. Yeah, again, we're reading. I'm learning to read lips here. Yes, there is, obviously. As I said before, what you really have is a situation where you need to reduce inflammatory foods in the diet. What are inflammatory foods? Sugar, definitely. So soft drinks, very little. Coffee, out. Coffee and arthritis do go hand in hand. If you have arthritis and you're drinking coffee, you don't like yourself. You just giving yourself a situation. You're just exacerbating that situation. More stagnant water, more mosquitoes, right? Milk, cheese, butter, less in the diet. Your meats, less red meat. Use more fish, more lean meat. So things like chicken when you get good ones, because that's the next whole thing by itself. Turkey, those type of things. You don't want to be really interfering with too much of pork. Those of you who do consume of that, nor beef and those type of things, simply because of the high level of protein and acid. That's going to cause a lot of problems and just basically create more inflammatory problems in the body. So that's something, again, that you need to pay very, very close attention to. Increase more water. So your benefits and things that you need would be omega-3s. There's a product we carry at Batson and Associates that has astaxanthin in it. So it is an omega-3, but it also has astaxanthin. You could also get information on that. Very effective in reducing pain and reducing inflammation. Inflammation formula, as I mentioned before, very, very good product. That helps significantly with reducing inflammatory response or reducing inflammation in the body. So a lot of the times you find that it is very effective in addressing situations associated with inflammation. Join tea as well. A tea that actually helps with arthritis. I mean, you can't get better than that. You just take 2 tea bags, put it in some hot water, you drink it, and you have less pain. What more you want? Or it is used in its application for a number of things. I mean, problems with sinusitis, problems with fibroids, polycystic ovaries, urinary tract infections, that type of thing. Because high levels of acetic acid. The only challenge is you try not to get it on your teeth because it would affect the enamel. So I tell people, when you mix it, and we normally recommend you mix it with, there's a product that we have called the same inflammation formula plus the silver or the mineral formula plus the colloidal silver. That's very good. So those 3 in combination actually can help significantly in addressing a number of issues in the body. Okay, so let me see if I got you. An 8-year-old or 48-year-old. Okay, yeah. A 48-year-old who has been diagnosed with diverticulitis. Right. Well, definitely that's something that we can address. Diverticulitis is a gastrointestinal problem. It is linked to inflammatory response. With that, you find fiber is a key component. People who have diverticulitis, so that's how it's pronounced, is individuals who have serious problems associated with fiber, lack of hydration, not enough water in the body. You have to remember the organ that depends, or the organ rather, that depends on water the most in the body is the intestines. The intestines. Because when you're dehydrated, your body pulls water from the intestines in order to compensate. So that is why people who have situations with constipation, acid reflux, those problems with bloating, flatulence, those type of things, you are early in the game to end up in a situation where you can end up with things like irritable bowel syndrome, Crohn's disease, diverticulitis, and those different issues because of that high inflammatory response in the upper intestines, which later on gets down into the lower intestine, small and large intestines. So that's something that you need to pay attention to. You can give us a call or visit. We'll be able to address that situation with you. Off the top of my head, a product I know that will help you definitely is the silver with the mineral formula, the advanced chlorophyll, and there's a product we have called digestive balance. We usually have a very good tea called gastro tea, comfort, but we don't have any tea right now. There are a lot of teas we have here in the country, but just waiting to get them out of where they need to be out of customs. So we should have them before the week is out. Well, the week out, because tomorrow is a holiday. So by next week, please God, you guys will have your teas, those gastro teas and prostate, liver, kidneys, those kinds. Okay, so that question, how is it that alkaline water is better than other water? I mean, the thing is, with alkaline water is a premium alkaline water. You would always hear people who have carried the notion that in order to be healthy, you need to alkaline your body. Now, technically, that is not correct, because the entire body cannot be alkaline. That's impossible. Blood is slightly alkaline, which is about 7.3. Oxygenated blood is more alkaline than deoxygenated blood, just maybe by about 0.5. So it means that the pH, for example, at your stomach at particular points in time would carry a pH of 2, which is acidic, because we know on the acid alkaline scale, 7 is in the middle, which is neutral. Anything going up is alkaline, so 7.1 and up. And anything going down, which would be like 7, 6.9, 6.8, that type of thing is acidic. Now, the thing is, hydrochloric acid in your stomach at any given time will have a pH of 2, which is strongly acidic. That burning through holes and burning through your skin and that type of thing. But your body doesn't store hydrochloric acid, does it? It is produced during digestion, and it does what it needs to do, and then it basically is not necessarily neutralized, but it cannot cause harm to the body after it has accomplished what it needs to accomplish. Now, the thing is, with your saliva and your urine, urine's supposed to be acidic, which is supposed to be like about 6.4, but your urine cannot be alkaline. If you have alkaline urine, you're sick. That's virtually impossible. So you have to understand that when we're talking acidity, alkalinity, there's a certain balance. Now, as with reference to all what I just said and how it pertains to the question about the alkaline water is this. It means that if you drink a water that is now has minerals in it, so a lot of other waters or water, they strip the minerals out of the water so that the water would last longer. So you find that they remove things like calcium, magnesium, sodium from the water. And that is so that it would remain longer. Then there are some cases they do things like reverse osmosis, which literally kills the water. With alkaline water, you have alkaline water, so the pH of the water will run anywhere in the vicinity of maybe 8.5, 9.2, somewhere around there. Then you have the water is a microclustered water, which is very important. So it means that water, in a drop of water, there are specific amount of clusters or particles of water. The alkaline water has very small particles. So it means that it's actually able to hydrate and get into the cell spaces much easier. And as a result of that, you find that it hydrates the body better. It also helps with medical conditions. So people who have things like arthritis, people who have diabetes, people who have hypertension, persons who have even cardiovascular disease, kidney problems. Alkaline water is used as a medical device in Japan. So they actually use it in hospitals and clinics with patients to improve different aspects of the body. So, I mean, that's one of the reasons why it's so vitally important to have your alkaline water, especially if you're now starting our program and you may be dehydrated, where you're not drinking or having your body weight divided by 2 in ounces in water. So if you weigh 160, half of 160 is 80. It means you also have at least 80 ounces of water daily, minimally, in one's routine. So that in itself is a key indicator as to the importance of how beneficial alkaline water is. Okay, excuse me. Let me see if I got you. Is a 45-year-old, you said? 35-year-old who has gastritis and they have a lot of pain and okay, yeah, you need to come to Batson Associates, man. We could fix that for you. The thing is with gastritis, you have infection. So there is some situation where pathogens, again, them fellas and them break loose from different parts of the intestines and start to behave badly. With gastritis, it could be that you have had H. pylori or some sort of, again, pathogen getting in there and causing another problem, infection, inflammatory response, that type of thing. From us, you'll have to use the silver and the mineral formula. You'll also have to use the digestive balance, digestive restore. We also carry a laminine digestive. That's also very good. There's also a stem cell product that we have. Because you see, what you don't want to happen is for that to reach the point where it actually gets so, how to put it, it gets so inflamed and so infected that even antibiotics would be very difficult to treat you. And that is where you're going to be in a lot of problems. So you need to, again, pay very, very close attention to that and try your utmost and actually start to address. The Alkaline water will also help as well. So you could always ask some questions, get some information where that is concerned, and we'll go along. We'll go from there, rather. IBS. Okay, so irritable bowel syndrome. What is IBS? IBS is an inflammatory bowel condition where persons experience very frequent bowel movement. Their stool is usually very soft, simply because, and you pass stool often, or there I would say pass stool often, where they could pass stool maybe about 10 to 15 times a day. It's usually very watery. It's a very uncomfortable thing to have. People like that can't go out because you can get bowel movement, and in some cases the bowel movement can be uncontrollable, where you literally could actually mess yourself. So people like that in some cases have to wear adult pampers, and it can get really bad. Our success rate of treating that very good. I mean, that to me is a walk in the park. As I say, when I have or experience persons who have been sick for years, it really does confuse me, because those are situations that can be corrected very easily, very, very easily. And again, if you need help, you need assistance, Batson Associates is the place for you. Trained consultants at Batson Associates. As I said before, we are consultant specialists in natural and integrative medicine. So it's not a matter of basically putting a plaster on a sore or dealing with the symptomology, but again, as I said before, actually addressing the root cause of that particular problem. And that's what you want. IBS that has now caused hemorrhoids? That's the question. Sorry? Oh, can IBS cause hemorrhoids? Yes, of course. Of course. And vice versa, hemorrhoids could cause IBS. Because most people who have hemorrhoids, people focus on hemorrhoids in the lower aspect of the, like, anus, rectum, that kind of thing. People don't understand that hemorrhoids could actually be up, way, way up inside because of how one's gastrointestinal system is designed. So hemorrhoids are not necessarily just to the tip there where you could see them and they're bulging and that type of thing. You can have hemorrhoids up, or you can have hemorrhoids, in the upper intestines. So in a case like that, it is a matter of actually, actually now addressing again that particular issue of dealing with the root cause of the problem. Very, very important. And as I said before, that's something we do at Batson Associates, because hemorrhoids, and then you can get the point where you actually have bleeding hemorrhoids, which are the worst to have, because surgery is something that a lot of people talk about, but you really don't want anybody cutting that part of your body. It's very uncomfortable. You can't sit down for weeks. You can run the risk of it not healing properly. There are so many different things, as opposed to actually addressing and dealing with the root aspect of that particular problem. Okay, so there's those contacts and telephone numbers. You can give us a call on 222, that's 222-8261. That's 222-8261, as well as 314-9975. That is 314-9975. And our locations, we are located on the first floor of Money Talks building. That is Money Talks building in Montrose, Chaguanas. Keep in mind, we do have road delivery, so you can avail yourself of that. Those of you who, you're trying to stay off the roads, you're trying to quarantine as much, those type of things. We do have delivery service available, and you can call any of those numbers I just mentioned, 222-8261. That's 222-8261, as well as 314-9975. 9975. That is 314-9975. And those locations again: first floor, Money Talks Building, Montrose, Chagonas. Tobago is the Triangle Building in Scarborough, Tobago. St. James is Western Main Road, St. James, Red Edge Mall. And Davie is the corner of Ramson Road Trace and the SS Erie Main Road. Okay. Okay, so let me see what I got here. Excuse me. You asked if we treat varicose veins and how. Okay. Well, varicose veins has to do with, the condition is actually known as varicosis. And that's where you have problems with those valves that close off or lock off in the legs to actually prevent blood from coming back down. So you have valves that actually like hold up. The problem with good varicose veins is like those valves actually now come like this, where they're no longer like this. So if they were here, they could block the blood from actually receding or going back down into the legs. But when they, so they're supposed to be like this, but when they're like this now, they allow blood to go down. And as a result of that, you have the condition known as varicosis, which results in varicose veins. How to treat compression stockings do help. Compression stockings, however, could only be worn for a certain period of time during the day. You can't wear, so it could, because it could overwear compression stockings and actually squeeze and significantly damage your circulation and make a bad problem worse. So you would have to wear it like maybe 1 hour, 2 hour intervals, that type of thing, maybe 2 hours for the day, whatever the case may be. But Batson Associates, there is a tea that we carry called circulation tea. And that tea actually helps very much or very good in dealing with that situation of varicose veins, spider veins, those type of veins. In addition to that too, is also a situation where we are actually able to use things like the inflammation formula. Balanced circulation is also a very good product that works. Santulan is a product a lot of people who had varicose veins, spider veins would have used, and as a result of that, you find they have gotten exceptionally good results with the varicose veins. So there are things that could help you. What you have to understand, you need to be a little patient, but you will get results, and of course you need to address things, as I said, the root cause of the problem. You're going to have to use a lot of omegas, you're going to have to use things like L-arginine, but of course, branding is very important. And that's one of the advantages that we have at Batson Associates, because we use the best. And of course, if you use the best, you're going to get the best results. Okay, very good. So with that being said, a pleasant good morning to our Facebook family. I'm going to be staying on Facebook for just a little bit again. And we'll go through some stuff. Those telephone numbers. Someone says, good morning, Dr. Batson. What eye product can someone use for cataract? He said it's like a veil over her eye. Well, as I said, I'm going to answer those after. So, as we always say at Batson Associates, if you think health is expensive, try sickness. If you think education is expensive, try ignorance. Thank you very much, listeners of 103.1 FM. Always a pleasure to be here. Look forward to speaking to you guys next week. Karen, even though I had a little problem hearing you, but always a pleasure. True. Yes. Bye-bye. Good. So, Facebook family, pleasant good morning. I want to say a good morning to Miss Lucita Jamet, Miss Desiree Villafana, Felix Pantue, providing pronouncing that correctly. June Bridget. Someone is saying, okay, Miss Jamat said that she's waiting for an eye drop. Miss Judy C. Paul, good morning, Dr. Batson. What eye product can someone use for cataract? She said it's like a veil over her eye. You could actually use, there's a particular cataract eye drop that we bring in. You could call and get some information on that. So you could actually use that one as well as the eye optics formula. And both of those eye drops will help in actually improving the situation. Keep in mind that cataract is mineral buildup on the lens of the eye. So it really is like a veil on the lens. And as a result of that, it actually causes serious blurred vision. So there are eye drops that can actually melt it or remove it from the lens and actually keep the integrity of the eyes as best as possible. Okay, Mr. Shads, good morning, sir. Shad said Dr. Batson takes time to explain everything. Yeah, that's an important thing, man. So we do have our delivery. Keep in mind, those of you who need delivery, we will have some updates coming for you guys in the upcoming days regarding some products and the offers that we're having on those products. Also, we're actually going to have some packages that we have put together expertly to address particular problems in the body. So that's something that you're actually going to see very shortly. Okay, guys, so I can't stay on too long. I have one question here. I'm going to answer this question and then I'm going to leave. This is Miss Winsome Slocombe. When can you recommend, can you recommend for nerve issues caused by pinched nerves in your lower back? Basically, if you have pinched nerves, well, you need a chiropractor, you need a good massage therapist too as well. You also basically need to address that issue and again deal with the root cause of the problem. So we need to address the nerves. We need to address the circulation, because if you don't fix the circulation, the nerves cannot be healed. The nerves cannot improve, right? At Batson Associates, Optimizer would work very good for that. Excuse me, something wants to go in my eye, is in my eye for the longest time. Things like Optimizer is going to help. The inflammation formula is going to help. And those are actually going to give you some great results as regards to those particular issues. Okay, someone is asking, Ms. Donnell is saying, good morning, Dr. Batson, love joking your get together weekly. What do you think someone stating that he put a catheter in because of his employer would not let him go to the bathroom during working hours? What? Well, if they did that, Ms. Ellis, that's very unfortunate. Very, very unfortunate. Why would you do something for that? Nah, that's craziness. You're going to end up in a lot of problems. You're basically buying trouble, as the people say, wholesale. You're literally purchasing trouble, sorry. I need delivery to Orlando, Florida. Yes, you're getting that. We actually started to do that now, you guys. So call the office, let them know your location or what you desire, and we would actually begin to do your consultations. We're looking at beginning that from next week after next. Okay. There's some other question. Okay, what do you have for swollen knees? Swollen knees, the Omega with the astaxanthin is very good. Inflammation formula is also very good. Optimizer is great as well. Nerve Restore can also help as well with that situation. Santulan Alkagen water. Okay, so you can give us a call and find out about that. So let me give you those telephone numbers again. You can give us a call on 222-8261. That's 222-8261, as well as 314-9975. That is 314-9975. And those locations, again, first floor Money Talks building in Montrose, Chagonas. We're also on the corner of Ramsey Road Trace and the SS Erie Main Road in Dede, as well as Red Edge Mall, Western Main Road, St. James. And Tobago is the Triangle building in Scarborough, Tobago. So guys, this is all the time I have. Look forward to seeing you guys on Sunday. Sunday, we're going to have some more time, so I'm going to go through some information with you guys. Sunday, I think we have an hour, but I'm going to do Facebook for an additional hour. So always a pleasure to be here. Keep in mind, we do have road delivery. Utilize the service. Please ensure that you remember that you deliver or that you requested delivery, and as well, we will always be with you. Dawn said, I'm glad how you answered the MD trying to discredit you. Yeah, of course. They don't throw stones at trees that bear no fruit. So, Facebook family, enjoy the rest of your day. God bless. Until next time. Take care.